All right, so insurance. Not exactly the most exciting thing, but it's actually way more connected to our lives than we think. We've got research articles, even some voice notes from you guys, and we're going to see what's interesting.
It's crazy how insurance touches everything. Health, money, even what jobs we can have. We think it's just a bill, but it's about risk, and risk is every day, right?
Okay, so let's start with American healthcare right now. We hear rising costs, but what does that even mean for
Think of
us?
it like this. Spending's going to go up almost 9% in 2024. And that's after an 8.2% jump this year. It's not just numbers, it's, people having to decide, do they go to the doctor?
Right.
In 2022, over 28% of adults put off care because of cost. And if you don't have insurance, it's even worse.
So yeah, not some spreadsheet. It's like skipping the doctor because of the bill.
Exactly. And that's why everyone's talking about free healthcare. Of course, nothing's free, right? The sources, they talk about how to pay for it. And it's big tax increases, maybe payroll, income tax, even a VAT, like in Europe.
Yeah, I've seen those numbers, 32% payroll tax or 25% income tax. Makes you think twice. But besides just how much it costs, what's the good side these sources talk about?
One really interesting thing is think about jobs. What if you weren't stuck at a job just for the insurance? You could start a business, do something you love, even change careers and not worry about losing your coverage, right?
That's a cool thought. So the whole economy could do better if people weren't so scared to take risks.
Some economists say so, yeah. They point to countries with universal health care. More people start businesses there. And this is cool. Some sources say one system could actually save money, $450 billion a year just from less paperwork.
Whoa. But wouldn't we wait forever to see a doctor? I hear that a lot.
It's a real concern. And the sources, they know that. They talk about solutions, though, really good primary care. If everyone had a doctor they saw regularly, for prevention, we might not need all those specialists later.
So having your go-to doctor knows your history. That could stop those crazy wait times.
Yeah, exactly. And telehealth, that comes up a lot, too, especially for rural areas or if you need a specialist far away.
Telehealth, yeah, it really took off during the pandemic. But it feels like we're just starting to use it.
Right, totally. Think about it. Seeing a specialist across the country without traveling or missing work, that could change everything.
Okay, but what about the government taking over healthcare? That's what a lot of people are scared of.
The sources, they actually debunk that myth. They say in most systems, you still choose your doctor. The goal is to make sure everyone gets good care, not about some bureaucrat telling you what to do.
So it's not the government choosing my healthcare, it's making sure everyone's covered, right?
Exactly. It's about putting people first, Now, even if we don't totally change healthcare tomorrow, there's stuff we can do now. One thing that comes up a lot is our data systems, especially after COVID. We got to modernize that.
So having good info to track and respond to health threats.
Exactly. With good data, we can see trends, understand disparities, use our resources, right? It's like a roadmap to, a healthier future.
Have a roadmap, yeah. What else?
Drug costs, huge problem, affects everyone, not just people on free healthcare. Sources say we got to make it easier for generics to get approved and give Medicare the power to negotiate prices with those drug companies.
Yeah, drug prices are insane these days.
It's about making sure everyone can, afford the meds they need. Now, our deep dive also went into something kind of unexpected. Did you know men in the U.S., they don't live as long as women? In 2022, it was 74.8 years for men, 80.2 for women.
Wow, that's a big difference. Why is that?
The sources, they say it's a bunch of things. COVID, of course, but men, they have more chronic diseases. And then there's social stuff, too. Their jobs are riskier. They don't go to the doctor as much.
So it's not just their bodies. It's their jobs, their lifestyle, even if they ask for help.
It's all connected. And it shows how healthcare, it's not just hospitals. It's about everything that affects our health.
It's about creating a culture where everyone feels good taking care of themselves.
Yeah.
What about primary care and community stuff? That keeps coming up.
The sources, they're big on this. Stronger primary care, it's good for everyone, but it also helps build a better system overall. They talk about expanding those community health centers, using community health workers to fill the gaps.
So healthcare that's closer to home, easier to get to.
Yeah. And community health workers, they can help people, understand the system, get the support they need.
Not just treating people when they're sick, but making the community healthier overall.
Absolutely. Empowering people, giving them the tools to, make healthy choices. And don't forget tech.
Telehealth, right?
Telehealth, but also other stuff like remote monitoring, especially for, chronic conditions. The sources talk about like digital diabetes care. It helps people stay healthy and actually saves money, less people going to the hospital.
That's amazing. Tech is really changing things, making it easier and more personalized. But like, what about privacy? And what if some people can't even get access to this tech?
Good points. We got to be careful with this stuff. Make sure it helps everyone, not just like the rich or tech savvy.
Right, because it's about using tech to make things more fair, not less.
Exactly. And that's why these conversations are so important. We got to think about this stuff, talk about it, and fight for a system that's fair for everyone.
Okay, we covered a lot. American healthcare, different systems, men's health, primary care, tech. What does this all mean for, like, the average person?
Great question. The big takeaway, I think, is insurance. It's not just some boring policy. It's part of your health, your money, even like your job.
Hmm.
Understanding it, knowing your options, being able to stand up for yourself, that gives you power.
About being in charge of your own health, right?
Exactly. Knowing your rights, asking the right questions, making the best choices for you and your family.
Okay, let's stop there for now. A lot to think about already.
In the next part, we'll go deeper into some of those solutions we talked about, like making primary care better, fixing those drug prices, and how tech can make healthcare better for everyone. So before we went off, we were talking about how knowing more about insurance can actually like give you more control.
Yeah, not just the policies, but how they, like, play into everything. Health, money, even jobs.
Totally. And one thing that kept popping up in the research was this idea of a single-payer healthcare system.
Single payer. Sounds kind of complicated. What does that even mean?
Basically, it means one group, usually the government, pays for everyone's healthcare. So instead of having all these different insurance companies, you'd have like one system that covers everything.
Kind of like Medicare, but for everyone.
Yeah, that's the basic idea. Now, our sources, they look at like the good and the bad of this kind of system, and it's definitely not simple. One of the big arguments for it is that it could actually like save money overall. We saw one study that estimated it could save like over $450 billion a year just in the US, mostly because of like simpler administration and being able to get lower drug prices.
That's a lot of money. But wouldn't that mean, like, way higher taxes to pay for it all?
Yeah, that's the trade-off, right? Instead of paying premiums to insurance companies, we'd probably see higher taxes to fund this single system. But some economists say that, those higher taxes might be balanced out by not having to pay premiums and out-of-pocket costs anymore, so some people might even end up saving money.
Huh. Interesting. So it's not just higher taxes bad. It's about looking at, like, all the healthcare spending and where it's going.
Exactly. And speaking of spending, let's talk about those worries about longer wait times. That's something people bring up a lot about single payer, and it's important to, talk about it.
Yeah, I mean, no one wants to wait months to see a doctor's or get, like, a procedure they need. What did the sources say about fixing that?
Well, they talk about a few things. One is really investing in like primary care. The idea is that if everyone has a doctor they see regularly, for checkups and stuff, it could catch things early and you might not need as much specialist care later on.
So it's like if you keep up with your car maintenance, you're less likely to have a major breakdown.
Right.
Invest in primary care so little health issues don't become like big, expensive problems.
That's a great way to put it. And another thing they mention is telehealth. We've seen how those virtual appointments can like make it easier to get care, especially if you're in a rural area or have trouble getting to an office.
Yeah, I actually had a telehealth appointment with my therapist a while back. Way easier than trying to, like, fit an in-person appointment into my schedule. Plus, no traffic.
Exactly. And as technology gets better, who knows what telehealth will be able to do? Think about like monitoring your health conditions remotely, talking to specialists across the country, even doing physical therapy virtually, all from home.
Wow, that's pretty amazing. It feels like healthcare is about to, like, totally change. What about the quality of care, though? Do the sources say if it would get better or worse under a single-payer system?
They do. And it's actually kind of interesting. The research suggests that the quality might actually go up. When people don't have to worry about the cost of care, they're more likely to, go to the doctor early on. And that often leads to better results.
Yeah, that makes sense. If you're not stressed about, like, co-pays and deductibles all the time, you're probably more likely to go to the doctor when you first start feeling sick, instead of waiting until it gets really bad.
Exactly. And when everyone has access to good care, it encourages the whole system to focus on prevention and, just overall well-being, not just treating people once they're already really sick.
Okay, so that's good to hear. But I know some people are also worried about, like, the government being in charge of their health care. They think it'll lead to long waits and not having many choices.
That's a valid concern, yeah. But it's important to remember that in most universal healthcare systems, people can still, choose their own doctors. It's about making sure everyone has access to good care, no matter their background or income, not about some, government person telling you what treatments you can have.
So it's more about setting standards and making sure everyone has basic coverage, not about someone, like, dictating your treatment plan.
That's right. It's about making the system more fair and accessible for everyone without, sacrificing quality or choice.
Okay, so even if we're not going to, like, completely overhaul healthcare in the U.S. anytime soon, are there things we can do now to improve the system we have?
Definitely. The sources talk about a bunch of practical steps we can take. One that keeps coming up is modernizing our public health data systems. This is especially important after COVID, which, really showed how we need to be better at tracking and responding to health threats.
It seems like having good data is super important for making good decisions about everything from, like, spending money to making health policies.
Absolutely. Having strong data systems can help us see trends, disparities, areas where we need to focus. It's like having a roadmap to a healthier future.
Okay, data is key. What else can we do?
Another big one is dealing with drug costs. Prescription drugs are a huge expense for a lot of Americans, and the prices just keep going up. The sources suggest things like making it easier for generic drugs to come out and letting Medicare negotiate drug prices with those companies.
Yeah, I've heard about those ideas, but wouldn't that, like, hurt innovation in the pharmaceutical industry if they can't charge as much for their drugs?
That's a worry people have. But the sources say there are ways to balance innovation with affordable meds. For example, maybe exploring different ways to fund drug development, like government grants or prize systems, so it's not just about charging high prices.
Interesting. So it's about finding creative solutions so people can get the medicines they need and medical research can keep going.
Right. We need to think outside the box because it's clear the current system isn't working for everyone.
Okay, so we've got data and drug costs. What other things can we do to, like, make healthcare better in America right now?
One that really stands out to me is putting more resources into primary care and community health. So expanding those community health centers, giving more support to primary care doctors, and using community health workers to reach people who need it.
So making healthcare more accessible to people where they live instead of expecting them to always go to, like, big hospitals or specialists.
That's the idea. It's about meeting people where they are and providing care that fits their needs. And community health workers can be a big part of that. They're often trusted members of the community who can help people understand the healthcare system, get support, and advocate for those who, maybe don't speak the language or face other challenges.
It sounds like a more holistic approach, not just treating illness, but building healthier communities.
Exactly. It's about addressing those things that impact health, like poverty, housing, food insecurity. Those things play a huge role in how healthy people are.
Yeah, it's hard to focus on your health if you're worried about, like, feeding your family or keeping a roof over your head.
Yeah.
We need to understand how all those things are connected.
Totally. It's a complicated web, but by looking at the whole picture and addressing those root causes, we can actually make things better for everyone.
So it's not just about building more hospitals or coming up with fancy new treatments. It's about investing in those basic things like primary care, community health, and addressing those social factors that affect health. That's how we create a situation where people can really thrive.
Exactly. And that brings us back to individual empowerment. When you understand the bigger picture, all those things that affect health and well-being, you're better able to navigate the system, stand up for yourself and your community, and make choices that support your health and the health of those around you.
So it's about connecting those individual choices to, like, the bigger system, knowing we're all part of it and understanding how we can work together to make it better.
Exactly. And that brings us to another exciting part, the role of technology.
We've talked about telehealth, but are there other ways tech is being used to improve, like, how we access healthcare?
Oh, absolutely. Things are changing all the time, and there's some really cool stuff happening. One thing that's really interesting is remote patient monitoring. It's using tech to track things like blood pressure, blood sugar, those kinds of things, so doctors can keep an eye on patients and step in if something seems off.
So it's like a virtual checkup from home.
Pretty much. And for people with chronic conditions, that can be like a game changer. They can manage their health, not have to go to the doctor's office all the time, and maybe even avoid those expensive hospital stays.
That's awesome. It seems like tech is really making healthcare more accessible and convenient. But what about like the downsides? What about privacy? Or what if some people can't afford these new technologies?
Those are really important questions. We have to think about those things carefully as we use more and more technology in healthcare. We need to make sure these new things help everyone, not just the people who can, afford the latest gadgets or who are good with computers.
Yeah. Right, because technology itself isn't good or bad. It's how we use it that matters.
Yes.
And when it comes to healthcare, we got to make sure it's used to make things more fair, not less.
Exactly. And that's why having these conversations is so important. We have to be aware of these issues and fight for a healthcare system that's fair and just for everyone.
All right, so in this part of our deep dive, we've talked about all sorts of things, from those single-payer systems to telehealth and remote monitoring. But we still have one more interesting thing to look at: the fact that men in the U.S. don't live as long as women.
Yeah, we touched on that earlier, but it's worth digging a little deeper into why that is and what we can do about it. We'll explore that more after a quick break, and we'll talk about how we can create a healthier future for everyone.
So but before the break, we were talking about that difference in how long men and women live here in the U.S. Kind of a heavy topic.
Yeah, definitely. In the sources, they talk about like a whole bunch of reasons why that is. One big thing is that men, they just have more chronic diseases,
Yeah.
heart disease, cancer, diabetes, all that.
So is it like men are just um, more likely to get those things, or is it something else?
Well, there's probably some biological stuff going on, but it's not that simple. The
Mm.
sources talk about how lifestyle, jobs, even like whether guys go to the doctor, all that plays a part too. Like statistically, men are more likely to have those jobs that are, physically hard or dangerous, and that can lead to injuries or like being around stuff that's bad for you.
Yeah, that makes sense. And I've heard that men are like less likely to go to the doctor even when they're sick. Is that like a cultural thing?
Oh, for sure. There's this whole idea that men are supposed to be tough and, not complain. So they end up putting off going to the doctor even when they have like serious symptoms. And we know that catching things early is super important, especially with things like cancer and heart disease.
So it's not just about biology, it's also about like changing how we think about this stuff and encouraging men to, take care of themselves.
Exactly. We need to make it okay for guys to, prioritize their health and go to the doctor when they need to. And that includes like regular checkups, not just waiting until something's really wrong.
So are there like programs or things that have worked to help close that gap in how long men and women live?
Yeah, the sources talk about some interesting approaches. One is to like include more men's health info in regular healthcare. So maybe talking about men's health issues during checkups, making sure guys feel comfortable asking questions and giving them resources for, managing those chronic conditions we talked about.
So it's about making those conversations about health, like a normal part of going to the doctor for men.
Exactly. And it's also about creating like spaces where men can actually talk about their health. Maybe men's health groups, community programs, even online stuff where they can, connect with each other and share their experiences.
I think that's so important, making those spaces where guys can like talk about this stuff without feeling judged or, weird about it.
For sure. And there's also been a lot of focus on like workplace wellness. A lot
Yeah.
of companies are realizing that, their employees' health is important, and that includes men's health. So they might offer health screenings at work, have fitness programs, and just try to create a culture where people feel like it's okay to like take care of themselves and have a life outside of work.
It sounds like a lot of these solutions are about like meeting men where they are, whether it's at the doctor's office, in the community, or at work.
That's a great way to put it. It's about making those conversations about health and well-being just a normal part of life for men and creating an environment where they feel, supported and encouraged to take care of themselves.
So we've talked a lot about insurance and healthcare,
Mm.
and it seems like it all comes back to people. It's not just about policies and numbers. It's about understanding what affects our health, for the choices we make to the like social and cultural stuff that influences us.
Absolutely. And that's what makes this whole deep dive so interesting. Insurance isn't just some financial thing, it's connected to like our values, what we care about, and how we think about being healthy.
And as we've learned, those ideas are always changing as we understand more about, our health, our money, our communities, and those systems that shape our lives.
Exactly. It's a journey, right? And that's why it's so important to stay curious, keep learning, talk to each other, and, speak up about what kind of healthcare system we want.
We've covered so much today, from how American healthcare works or doesn't, to different ways of doing things, from those differences in how long men and women live to the importance of, primary care and community health. We've talked about tech and how it can change things, and most importantly, how we can all take control of our own health.
It's a lot to take in. We just scratched the surface, but hopefully this deep dive got you thinking and, maybe inspired you to learn more about all this stuff.
And remember, this conversation doesn't end here. Keep learning, talk to people, and let your elected officials know what you think. Your voice matters, and you can actually make a difference.
Absolutely. We're all in this together.
That's it for our deep dive into the world of insurance. We hope you found it, interesting and helpful, and maybe even a little inspiring. Stay curious, stay engaged, and stay well.